Over the coming weeks, we are going to hear a lot about testing, how we are doing, what other countries have done, and what is the importance of it. Today, I want to dig a little deeper as to why the UK is currently in the position that it's in, what we can learn from other countries, and what the UK can do going forward. But firstly, it's important to truly understand what the advantages of testing your population does. Extensive testing is a very valuable tool to 1. Track the virus, 2. Trace people it's come into contact with, and 3. Control the virus, for example, quarantine. Because, as the General Director of the World Health Organization said, you can't fight a virus if you don't know where it is. Testing also allows individuals to take matters into their own hands and make social distancing decisions on their own, both to protect those around them and to protect themselves from those who are infected around them. Remember, 20% of people who have the virus show absolutely no symptoms, meaning those who show no symptoms are probably responsible for half of the known cases. If these people were tested and therefore isolated, it would have had a dramatic impact on the number of people who got infected. Testing also helps the public support government decision making. Now, Boris Johnson was clearly reluctant to use lockdown measures too early, with advice from his team of epidemiologists, behavioural scientists, and biologists. What would have really helped support this measure is testing. One thing that's necessary for people to really support any kind of intervention is for it to be seen to be proportionate to the threat. There would have been 2 key benefits to mass testing in this instance. 1, the population would be able to see how aggressive this virus is on the amount of people it's infected. And 2, it would have meant that people would have had more information to be able to self-isolate. In a nutshell, there are 2 ways in which you can deal with your population. You can have an enforced lockdown and therefore you are reducing the risk of spread because everyone's indoors. Or alternatively, if everyone is tested, those who are testing positive for COVID-19 are the only ones that need to self-isolate. All those who have not come into contact with anyone who has tested positive can resume normal life, meaning less government intervention and enforcement. In our case, what we saw was a change in government measures, but no real data to help support the extent of the measure due to lack of testing, which is why we've seen so many instances of people not complying with the new government lockdown measures. Let's talk about how the test is administered, how long the procedure takes, how long to get your results, and how this compares with the countries dealing with COVID-19 best. Now, the most common way of testing is the swab. They swab the back of your nose and the back of your throat. This part is very fast and it only takes a matter of seconds to do. So why is there so much talk about not enough testing when it only takes seconds to do? Now, this is due to how long your results get back from the lab. They try to get results back within 1 to 2 days, but UK results at the moment can take up to 4 days to get your results, in some cases longer. So why? Well, the problem is supply. We need supply of the swabs used to take your sample. We need supply of the chemicals to test the swabs, along with the equipment and resources needed in the lab to test your swab samples. Now, this is what Boris Johnson is referring to when he speaks about the bottleneck and global shortages. The fact is, we are not the only country right now requesting them, and the resources needed is not something that medical supply chains just have sitting around in bulk. It means they are working frantically hard now to create the amount needed to supply the world. This was always going to be a tough test for an already fragile medical supply chain. So why are countries like Singapore, Taiwan, or South Korea doing so well when it comes to testing? Well, let's look at South Korea, as their population is most similar to ours. Let's look at their numbers to illustrate how well South Korea is doing. The backbone of South Korea's success has been mass, indiscriminate testing, followed by rigorous contact tracing and the quarantine of anyone the carrier has come into contact with and returning a result within 24 hours by text. So as of March 19th, the country had conducted more than 307,000 tests. That's the highest per capita in the world. The UK had conducted 64,600 tests, which is more than any other European country apart from Italy, but still far below the level needed in order to truly track the extent of the outbreak. The US had tested even less than that by that period. So how was South Korea so prepared? How was they able to achieve such mass testing, and what can we learn from this? Well, firstly, it's important to take into account that South Korea suffered something similar back in 2015 with the case of the MERS virus, that they didn't contain very well and unfortunately recorded 186 cases, 38 deaths, which was more than anywhere else outside of the Middle East. But how they reacted to MERS is what prepared them to Covid-19. After MERS, the government and the country as a whole completely overhauled the response to respiratory infections, fast-tracking the production and test kits and equipping hospitals with infection control units and negative pressure rooms. So in short, they already had a lot of things in place before in preparation for any future pandemic, meaning they were less heavily reliant on the medical supply chain as the rest of us. So what can the UK do going forward? The answer is, in most cases in the 21st century, technology. But to understand what we can do going forward, we need to understand what has been one of our major shortfalls. And one of the key shortfalls has been the lack of laboratories to test the samples. David Farron, a consultant in medical microbiology and an infection control doctor in Northern Ireland, believes that the UK-wide consolidation in the number of pathology laboratories resulting from a review in 2006 left the UK less equipped to deal with a pandemic of this scale. He said, a lot of laboratories were centralised, and each hospital now wouldn't necessarily have a fully functioning lab. So we weren't in a good position as we might have been 10 to 15 years ago, when we might have had more staff and more of a laboratory footprint. The race to get as many labs up and running has already begun. A new testing facility for coronavirus has now opened in Milton Keynes. But opening labs alone is not going to be enough, and that's where technology plays its part. Again, we can learn a lot from across the Pacific. To carry out mass testing at the scale South Korea did doesn't only require clear planning and dogged perseverance, but also requires ingenuity. Alongside the creative ways they tested citizens by way of car drive-through testing and converting public phone boxes into testing spaces, they also created a smartphone app that provides GPS maps to track the infection spread. The government was able to use mobile phones to not only track, but also send warnings like, watch out, there's a Covid-19 patient in your area. England's Health Secretary Matt Hancock announced on the 24th of March that the government had purchased 3.5 million antibody tests, promising to make them available to NHS frontline staff very soon, so that people could find out whether they had been infected and get back to work as quickly as possible. Sharon Peacock, Director of the National Infection Service at Public Health England, said that subject to test this week, kits for swab testing at the point of care could be available to use at home within days. The online retailer Amazon has agreed to distribute the tests, which would also be available on sale in pharmacies. The tests won't have to be sent away for analysis, giving instant results through a finger prick test. In summary, even though we had a head start on many other countries on knowing that COVID-19 is on its way, we have been playing catch up ever since it's arrived. And this is due to a number of factors, but what stands out most to me is the lack of preparation due to the government's lack of experience in dealing with pandemics of this scale, and also the major shortfall on a lack of testing. I would expect to see a huge push in testing in the coming days and weeks, and in order for this to happen, expect a lot more talk on home test kits, drive-through testing, announcements on investments on new facilities, as well as being creative in making testing spaces, greater use of technology by way of smartphone apps, and ways in which we can get results times reduced from days to minutes. If you enjoyed the information received in the video today, please like and subscribe. And also leave a comment below if there's any other topics you would like me to talk about. It doesn't have to be about COVID-19. It could be about absolutely anything. I'll be back very soon with a new video, either keeping you informed or entertained. But in the meantime, please stay safe. Please stay at home. Take care.